Well, thank you. I appreciate you having me here. And first off, though, if anybody has a home in the area, I'm willing to do a home exchange. Just for you can have ours in Colorado for a little bit, and we can come here for a little bit. We're not near the mountains, but it's still nice. So this is what this is. It's interesting because I told people, I said that all this activity is happening in the most beautiful states. It's Oregon, it's Colorado, it's Washington, it's Maine. These are just gorgeous areas. And when I talked to you, I was talking to some young people in Colorado, and I said, look out your window. You get high looking out your window. You can go hiking, you can go biking, you can go walking, you can go fishing, you can go whatever you need to do. There's some beautiful ways to enjoy life just outside your window. So I appreciate you having me here. And I've been in tobacco prevention now for 20 years, and that's how I got involved in the marijuana issue about 3 years ago. And it was because I was listening to all this information come from the marijuana folks, same things I heard from tobacco, that product's not addictive, they don't want to talk about the harm of the product, we're not targeting children, and this is about freedom and rights. And this was the mantra of the tobacco industry, still is to this day, that went on for several decades. And so I said, well, this doesn't sound right. And so I spent, 3 years ago is when I dove into learning about marijuana, medical marijuana, and what's the truth, what isn't, and what's really happening. So hopefully today you'll get a snapshot a little bit of what's happening in Colorado. And the hope is that, again, it's great that you're doing these types of educational forums. I explained to somebody that before our vote in 2012, we didn't have any educational forums. We didn't have coalitions in our state working on this issue. We had no substance abuse coalition working on the issue, on any issues in Colorado. So we were a very disorganized state, probably a good target. And really, it's a much different picture today. We can put 100 or 200 people in a room that are energized about the issue now. So it is very different. So I applaud you all for getting educated about the issue and hearing some of the different sides of the story. So, today we'll just review some of the latest research, understand, this is really important. So hopefully from this talk, you'll start to understand really critical differences. The differences between cannabis-based medicine and the medical marijuana movement. The difference between addressing incarceration versus legalization and commercialization. And so those are really critical issues that folks don't necessarily separate when they talk about marijuana use. And the folks from the marijuana industry kind of want to group all of that together. So we'll talk about that. So again, understand, we're going to talk about the similarities between tobacco and the marijuana industry. All drugs are different. This is about the strategies and the messaging of the marijuana folks to try to normalize their drug, similar to what tobacco had done to normalize their drug. So you'll talk about that and the impact of commercialization in Colorado. So this is kind of the story of marijuana use, and it's really most drug use, which is this inverse relationship between perception of harm and use. So if I think it doesn't cause much harm, I'm more likely to try it. So that's just makes complete sense. So here's just some of the latest data. This just came out. This is a longitudinal study that followed a regular marijuana user from their teen years to the age of 30. And so you'll see this repeated in several other studies, but found that these are regular marijuana users, 60% less likely to graduate school, 18 times more likely to be dependent on the drug, 7 times more likely to attempt suicide, and 8 times more likely to use another drug. So again, you're going to see there's just a lot more accumulating data about the impact on the young brain, the developing brain, and its impact on mental health, which is really important. So these are critical issues, and we'll talk about why this is important when you see how medical marijuana is marketed in Colorado. Remember these types of studies. This was interesting too. This was a look at casual marijuana users, young adults. And so these were people who were smoking about 3 to 4 times a week. And again, people who perceived that they were having the marijuana use was not having impact. And so what they found was that they found abnormalities in 2 regions of the brain, both emotion and motivation. And so that was really important. And a lot of the studies are what are called dose dependent, meaning the more somebody used, the more likely something negative was going to occur. And so again, as the author of the study said, that people think a little recreational use shouldn't cause a problem if I'm doing okay at work and school, but our study suggests otherwise. So this was interesting, that this was college students with a psychiatric disorder and a dependency with a drug. And so what they found was those who were dependent on marijuana versus alcohol or other drugs were much more likely to have dropped out of school than those dependent on other drugs. So again, this is more of the data about adolescence and marijuana use, and you've heard about this potentially, the drop in IQ, and some of this can be permanent, and so that's really a big concern. And one of the things we're going to stress today, this is a whole new world of marijuana use, a whole new world. If you are my age, I'm 23. Okay, 27 to be honest with you, plus a few. Okay, I'm 50, so I'm 50. But when you look back at what, if you were using marijuana in the 70s, 80s, 90s, THC content of marijuana was 3 to 5%. So remember that number, 3 to 5%. And we'll talk about that today. We're also going to show why, when we look at the tobacco industry, why addiction rates and dependency are also things I would put an asterisk on. So we'll talk about that. We'll talk about ER visits. In the late 90s, marijuana-related ER visits were about 16,000. Now it's over 460,000 in the United States. So again, really important. And again, talking about impact on suicide, and we'll talk about that in a little bit later as well. Heart disease. So what happens is when people say, well, there's the science on tobacco and marijuana are clearly not the same. There's far more science on tobacco than there is marijuana. This is a developing field. So that information may not exist doesn't mean that causation is not going to be there. So science evolves. And one of the areas I used to, when I worked in tobacco, 20 years ago, someone said, well, my dad smoked all his life. He didn't die of smoking. He died of a heart attack. And people would always say that, so because there was no association. People associated smoking in the lungs, but they didn't associate smoking in something else. And so again, it was over time that you learn about, we're at the 50-year anniversary of the Surgeon General's report. They added 3 more diseases attributable to smoking. Again, it's a process. It's a process of learning. You start out with associations, and then you work your way to causation. But it's a long process. So we know enough about marijuana to be very concerned. And this is one of the evolving areas, is to looking at heart disease. This was in young and middle-aged adults. There's another German study that came out. They reviewed autopsies of these 11 individuals. And for 2 of them, they could rule out no other cause of death but cannabis. These were all young males, or middle-aged, when I'm 50, 30, 40s, middle-aged. But one of them had a pre-existing heart condition. And the message from the study was people with heart conditions need to be very fearful about marijuana use because, again, when you start smoking marijuana, what happens? Your heart rate goes up. It isn't chilling. It doesn't low you down. Your heart rate goes up and goes up about an average of 20 beats per minute. So again, that's also a concern. Marijuana smoke. Again, the cancer information on smoking is far more than on cigarettes, is far more than on marijuana. But does that mean we won't find it? No. California classifies marijuana smoke as a carcinogen. There's 33 chemicals California classifies as carcinogens that are both in tobacco and marijuana smoke. So again, what we learned over time with cigarette smoking is cigarette smoking those chemicals get into your blood and are transported throughout your body. So slowly but surely, more and more cancers from smoking cigarettes have been attributed because of the ability it transports it throughout the body. So again, this is evolving as well. So when you think of Colorado, this is what we want you to think of. Now, don't be going after Peyton Manning now. Now, when I gave this presentation just after the Super Bowl, I would say, well, don't think about us Super Bowl Broncos. We had an accident. What happened was we sent our junior varsity team to the Super Bowl. The varsity team got lost, so Peyton Manning never showed up there. It never happened. So that Super Bowl just never happened. But now we're doing better, so now I can put this back up there. So.
Well, you heard what he said, though.
What's that?
You heard what he said recently.
Oh, about his pizza place?
Yeah.
Yes, I did.
Okay.
Yeah, he said a little. He owns some pizza franchises and talked about marijuana and pizza franchises and eating, and so you can fill in the rest of the blanks. So he's a funny guy, so I don't think he was endorsing legalization or marijuana use, but he just was being funny. So. But this is what we want you to think of: gorgeous mountains, the Air Force Academy in Colorado Springs, whatever. But this is unfortunately what the image is now of Colorado. So that's not good. And again, remember that we'll talk about the key messaging of the marijuana folks, and this is not, remember it's supposed to be about social justice. Remember it's about helping communities of color. That's why they legalized supposedly, to make us safer. It doesn't quite look that way. So this is what's happening in Colorado. The most recent poll showed that legalization support has dropped 17% in our state, now below 50% in Colorado. So there's a reason for that. You know, why that change is happening, we don't know, but hopefully today you'll probably see what some of the reasons may be. So this is what we talk about. The tobacco industry has never changed its script and never will. It's the same script decade after decade after decade. And so it's the same old industry, same script. Now we have a new industry, a marijuana industry with the same script of the tobacco industry. So here's the messages people will get about commercializing or legalizing marijuana. As somebody once said, legalization in theory is much better than legalization in practice. So you'll see what practicing the theory really turns out to be. But this is going to make us safer, get rid of that evil black market. It's going to address incarceration and drug use. The war on drugs and prohibition is a failure. It's a money maker. It's safer than alcohol, and it's going to protect our kids and communities. It all sounds good. It makes logical sense to people who are hearing it. So, well, I guess, yeah, it makes sense. Regulating it's going to make us safer. So we'll talk about what it really means. So when people say, well, the war on drugs is a failure, I say, what do you mean by that? What do you mean? You know, what are the indicators you use to determine a failure and success? Is one of them use? Would that be a determination, whether a lot of people are using the drug or fewer people are using the drug? Well, legalized drugs, regulated drugs, are the most used drugs. Legalized, regulated drugs are that cause the most harm. They cost us the most. So what is it that you're using to say the failure? What it might be is, what most likely at time people are talking about is incarceration. And you know, I'm in agreement with everyone that I don't want that low-level marijuana user to have a criminal record that's going to prevent them from getting financial aid, that's going to prevent them from going to school. You know, we don't want to be using that and putting that criminal record on a low-level user. In states like Maine and in Oregon, you decriminalized. You know, Oregon was one of the first states to decriminalize in the 1970s. So you're getting a citation, you're not getting put cuffs, you're not going to jail. We'll talk about that in a second. And drugs are money losers. You know, I love when people say, it's a social experiment. I'm like, it's not a social experiment. We've actually legalized a combustible drug before. It's really, we have. And we actually know what happens. That's why I'm in there like, I know how this script goes. I can tell you how this movie ends. You know, we'll start out, this is the beginning. And here's the lesson of drug use. Most of it begins in the teen years. They make their money off addiction, not the casual user, not the person who picks it up once or twice. It's the addiction. And they're money losers. Societal costs are always much greater than the revenue you're going to make. So that's the perception. All you hear about is all this money we're making in Colorado. It's just raining money. You know, it's like, I call it marijuana industry math. You know, I think Wall Street firms use that. They'd be locked up if they just said, we just made all this revenue. We're not going to report the expenses, but we made a lot of revenue. So that's what it is. And this is why we have to be fearful not just of where we are with marijuana, but where we can go. So this was put together by Campaign for Tobacco-Free Kids. It shows how the tobacco companies manipulated the cigarette to make it more attractive and make it more addictive. And so I talk about Victor DeNoble was a scientist with Philip Morris, and his specialty was addiction. And I've worked with him in different parts of the country to go talk to young people. He does a great talk. He's doing fewer talks, but he does great talks to high school students because he tells them, he holds up a cigarette and said, this is the most carefully engineered product in the world. Cigarette companies know how you hold the product. They know what happens to your heart, to your blood, to your brain. They know how long it takes for that nicotine to get to your brain. And so what they would do is they added flavorings to make it more appealing. They added menthol to change your head and neck sensory mechanisms so that first experience wasn't harsh. They added ammonia to speed nicotine getting to the brain. That's the science of addiction. And so when people say we're going to be safer, I said, are we really going to be safer when Philip Morris gets marijuana? Really? We're going to be much better when R.J. Reynolds and Philip Morris take on marijuana. We're all going to be a lot safer because their goal is going to be less use. Their goal is going to be not to make it more addictive. Of course not. So this is what, not just where we are, but we need to be fearful of where this goes, what door you're going to open, because they're really good. You know, Philip Morris has a secret laboratory in Germany called INBIFO. We have all their secret documents now. Then most likely we think we're doing their toxicology studies and other things they didn't want attorneys or anybody in the United States to see. And again, that's the people that you're going to hand this to. We have access to the secret documents because of the lawsuits, and what they were saying during the Carter administration, again, I'm not old enough to know the 70s because I'm only 22, but my parents tell me that when the Carter administration was going on, legalization was a discussion. So the secret documents basically said, yes, we got the machines to roll it and the fields to grow it. We're ready to go. So tobacco companies were looking at legalization decades ago. Absolutely. Are they in the, we'll talk about how they might be in the game, but they're not in the game, you know, they're not in the game right now, but they will be. What reason wouldn't they be in?
They're in the e-cigarette game, though.
Yeah, we'll talk about that. So this is 6 months after our election, and this is really important. When you look at the content of our legalization bill, and we'll talk about Oregon and Alaska's proposed legalization bills. Remember, these were decades in the making. These weren't some organic movements of a few people that want to smoke marijuana that decided to do this and wrote up something and stuck it in. This is a decades-long in the making project. Because this happened just 6 months after our election. The former president of Mexico is sitting with an ex-Microsoft executive ready to introduce the national marijuana brand. That didn't probably just pop up like that. That was probably well planned and thought of well in advance. So remember that issue when we come back to that, why that's important. So here's our timeline in Colorado. In 2000, we legalized medical marijuana. 2009 is when basically the federal government said, we're going to look the other way. And that's when the explosion of marijuana happened and commercialization went big time. Because people will say, well, what's it like to have commercialization now? I said, we've had it for 4 years, and we can tell you what's happened. So the stores for recreation opened in January. We had, look what happened, from 2001 to 2008, we had 5,900 registered patient applications. And then at the end of 2009, it went to 41,000. Then by election in 2012, we had hundreds of marijuana dispensaries and 108,000 people registered as medical card holders. Almost all of those are chronic pain, young males. There's a small percent are cancer patients, small percent are HIV. This is what, you know, this was not about, most people will tell you they voted for it because they thought they were helping the cancer patient. All these people we do want to help, but that's what happened. So this is what commercialization brings. All of these are happening in Colorado. More sophisticated operations. We have lobbyists, marijuana lobbyists all over the state. We have former elected officials going to work for the marijuana lobby. More access points drug, more promotion, more mass producing products, more potent products, branding, etc. So how's it going? Well, more marijuana-related deaths since commercialization, more marijuana traffic fatalities, more marijuana-related DUIDs, more marijuana-related ER visits, more hospitalizations, more illegal diversion of marijuana, more child poisonings, more hash oil explosions, more incidences in schools, more potent marijuana, more positive marijuana employee rates, high use among youth and young adults, child-like marijuana products, and we dispense our medical marijuana like alcohol, not medicine. So how's it going? Not bad, huh? So we'll talk about more details of that. But that's what you don't hear in the media. You know, and all of those come with expenses. All of those have a dollar figure on them. When you're doing a traffic fatality, there's a dollar figure. ER visits, hospitalizations, illegal diversion, all of that has a figure on it. So who paid for it? The other fiction was this was a grassroots movement of Coloradans. This is an orchestrated movement of 3 entities. The Drug Policy Alliance, the Marijuana Policy Project, and the late Peter Lewis, and now his estate. Those 3 entities paid for the majority of Colorado's ballot measure and Washington's ballot measure. Same groups that are paying now for Oregon and Alaska's. So more than 90% of our funds came from out of state. This was not, but media never talks about that. It's always Coloradans supported legalization, but that's not the case. So again, Drug Policy Alliance Executive Director was interviewed November 2013. who talked about, absolutely, this is about legalization of cocaine, of heroin, of hash, of ecstasy. No one talks about that. They weren't private about it. This is one of the conspiracy theory of us crazies in Colorado. This was on, their discussion with NBC News. Listen to their messaging. The war on drugs is a failure. It's not war on marijuana. It's the war on drugs is a failure. This is about creating greater access to all drugs. And that's their words, not mine. This is the issue of freedom. The executive director of the Drug Policy Alliance tied it to abolishing slavery and women's right to vote. And this is a Philip Morris ad that was running in Asia and Africa not too long ago. Freedom. It's not about freedom. Drug use isn't about freedom. I carry a Bill of Rights in my wallet because I've heard this discussion for 20 years. There's no mention of marijuana and cigarette smoking in the Bill of Rights. We don't get rights when we purchase and use a product. We have freedom of speech, freedom to assemble. Those are the great rights that we want. But this isn't about freedom. Philip Morris doesn't care about freedom. So it begins with medical. This is from NORML, one of the long-term legalization groups, says we'll use medical marijuana as a red herring to give marijuana a good name. So again, we have medicine by popular vote rather than a scientifically testing of marijuana by the FDA. This is Free Joint Friday at one of our medical marijuana places. Is that medical? If all of us walked into our local pharmacy tomorrow and they said, hey, how you doing today? Oh my gosh, and it's not a pharmacist, it's a drug tender. And the drug tender says, hey, I've got some wonderful painkillers on the top shelf that are really good. Which one would you like today? And by the way, we have 2 for 1. So if you wanted 2 for 1 Vicodins today, would you like that? What would happen? The media would be there in 30 minutes. The FDA would be there probably in 60 minutes. But that's how we dispense medical marijuana in Colorado. We dispense it like alcohol. Is that patient focused? These are medical ads. 99-cent joints. 420 specials all day. Top shelf marijuana. Premium. Scissor hash. You don't know what scissor hash is, you'll learn. But again, another potent form of marijuana. So again, is that medical? This was the Denver Post, has a website. Our newspaper has a website dedicated to promoting marijuana use called The Cannabist. Now there's a whole other discussion about crossing the ethical lines journalism, but we won't go into that today. But this is what they have. They have marijuana strains that say will cure depression. They will cure bipolar disorder, PTSD. In fact, Leafly, who they partnered with, we did a review of this. They said 88 strains of marijuana for depression, 25 for PTSD, 40 for bipolar, and 40 for ADHD, 23 for bipolar. So myself, Dr. Chris Thurstone, who's a pediatric substance abuse expert in our state, and Dr. Eden Evans with Massachusetts General Hospital, we sent a letter to the Denver Post, say, please tell us the dosage, tell us the duration for each of these recommendations, talk about the counterindications. Are you recommending that they stop taking their FDA-approved medicine, right? Because this is very serious. This is when the chuckles stop. This is when we're not the stoner movie anymore. This is when you're talking to somebody who might be suicidal, somebody who has severe depression, who is being told, go ahead, smoke whatever you want, whenever you want, because it's going to take care of it. That's reckless. So the good news is, half the story, the Denver Post has pulled this down and no longer making these medical recommendations. But Leafly is. Leafly, this is the advertisement, the first advertisement in the New York Times for medical marijuana. We sent the same letter to Leafly. We have no response. Please, if you indeed this is medicine, none of us, if you walked into your doctor and they said, hey, whatever you want, what's your problem? Whatever you want, I'll write it up for you. We would be a little frightened. But this is how medicine is being done in Colorado. That's not medicine. That's not patient-focused. So when I do this talk all over the state, and I've done it for 2 years now, where I go to clinics, I go to Rotary clubs or parent groups, I said, how many people have heard of Sativex? And never a hand goes up. And I said, we're supposed to be the epicenter of medical marijuana according to the marijuana industry. Colorado is where it's at, right? We're the epicenter of great medical marijuana. But you don't know about Sativex. How come you don't know about Sativex? Why? It's a cannabis-based medicine. It's an inhaler. It's in its final stages of FDA approval. They're looking at it for MS spasticity, cancer pain, neuropathic pain. It's a 1-to-1 THC and cannabidiol, which we'll talk about in a second, ratio. It's not a bong, it's not a joint, it's not a vaporizer. Why don't they tell you about it? If they're truly a patient-focused people, why aren't they telling you about Sativex? Why don't they tell you what drug approval there is? I'm not endorsing Sativex, but it's just knowing that it's there. And this is what, so there's a difference between cannabis-based medicine and the medical marijuana movement, which is about mass commercialization and use. So I'm all in favor of testing marijuana for medicine. And if there's political barriers to testing it, get rid of them. Because we should be looking at everything for medicine. And what we do with all medicine is we look at the plant and say, what can be good? And we're trying to extract what's good and help the patient. And like every medicine, I want to know, is there going to be a side effect? Is there going to be something that goes wrong? But I want to make sure you get good medicine. And that's what we want, a scientific approach to medical marijuana, not free joint Friday, 420 specials, right? That's not science. That's not good medicine. The same company that makes Sativex makes Epidiolex. You may have heard about the young kids coming to Colorado, families bringing their young children who have a very severe form of epilepsy called Dravet syndrome. And so the FDA has given orphan drug status to the same company that makes Sativex. They also make Epidiolex, which is, it contains just CBD, cannabidiol. So CBD is actually a pretty difficult extraction to extract CBD but not get a lot of THC in the process. So that's going on. And again, this is what we want. You want a science-based approach. We all want the FDA to do better on all drugs. We have a prescription drug problem we need to be watching out for. We need to be monitoring. So, but this is, again, a process that has science and the patient in mind. That's what we want. So let's talk about why this is tied into that. So let's talk about Colorado. This young man, 19 years old, came to Colorado after legalization. He ate one marijuana cookie, had a cannabis-induced psychosis, and jumped off the balcony and killed himself. That one marijuana cookie had 6 joints worth of marijuana in one cookie. And he's 19 years old, which wasn't that supposed to be solved with legalization, that minors weren't going to be getting marijuana anymore? But what's interesting is that he ate a medical cookie. So this is kind of the cute little wording we play in Colorado, that a cookie becomes medicine when I call it a medible. Right? That's what these are called medibles. So, and he ate a cookie from Sweetgrass Kitchen. This is the Sweetgrass Kitchen website many months after that death. No warning, no dosage, no instruction. That's a reckless industry. And you'll see here, these cookies, 50 milligrams of cannabis, and this is for those who like to medicate in the morning. So getting high, we say medicate, so that makes it medicine. So if you want to get high in the morning, they recommend that cookie. So again, is that medicine? So Dr. Thurstone, who was the partner in our letter, he warned us about this. ABC News interview just several months before that death. He said, yes, we're seeing kids, and he runs Denver's pediatric substance abuse program. He said, we're treating kids here who have paranoia, seeing and hearing things that aren't there. Adolescent exposure to marijuana raises the risk of permanent psychosis in adulthood. And I have another physician that I work with. He said, 5 years ago, marijuana wasn't even on my radar. He'd been working 20 years in substance abuse, not even on my radar. Now, same thing. We got kids in here, full-blown psychosis, serious mental health issues, and that's what's happening. That's kind of happening underneath there. So I brought this up again. Remember what they did is they altered the product to make it more appealing to that new user. Well, now we have this in Colorado. This is soda for newbies. That's marijuana soda for newbies. They lowered the THC content, so it's not going to knock you out like some of the other products will. So again, it's all starting. It's all part of changing the product to make it more appealing, to get more use. Not only that, again, this is the Denver Post marijuana website. You can see their journalism at work. But this was a Q&A for newbies. Our Denver Post is instructing people how to use marijuana if you haven't used it in a while. So again, when I go back and people, and I always say, what website did the cartels have? What branded products did the cartels have? Now look what commercialization it creates. Now the Denver Post has a forum. They can say, hey everybody, let's all use marijuana and we'll show you how. So this is what marijuana use looks like in Colorado. So I brought some with me today. I brought it with me here so you could see it. This is what marijuana use looks like in Colorado. This was all being sold under medical too. So, and these are not marijuana, by the way. But in Colorado, you wouldn't know. That's the scary part. You would not know. So we have never made marijuana use easier, more accessible, and easier to conceal for kids and adults. Back if you were smoking marijuana when I was young, it was a bong, a pipe, or a joint. And you're not probably hiding that from anybody. The kids who would go out and come back, you could smell it. Now, I can do all of these types, and you're not going to know until you might see impairment. So that's what's, for an employer, that's scary. For a school, that's scary. For a parent, that's scary. So, and we also have problems of there was a young kid who, a middle schooler, who a friend gave him a marijuana brownie, and he could not remember. His father had called police. They were searching for him. He showed up at home with scrapes and bruises. He has no idea what happened. He, like 3 hours of his day just kind of blocked out. These are products that I bought and some others just bought. We have marijuana punch. These are lemon drops, chocolate bar. This looks exactly like Fruity Pebbles cereal. And we have a strawberry crunch bar. And look, I'll show you.
There they are.
Yep. So this is the candy version, and this is the marijuana version. Oh, and by the way, we're not targeting children, right? Remember that story? Yep. Oh, of course not. What kid would like these? I have a 6- and 7-year-old. They would never want a chocolate bar or gummy bear. So that's what I tell people. This is the tobacco industry on steroids when it comes to targeting children. They're doing the same thing. R.J. Reynolds would say, well, cartoon characters not targeting kids. Adults like cartoons too. And I was debating the marijuana folks at a city council meeting, and they said, well, adults like gummy bears too. Really? Do we have to do this again? And that's why I'm involved, because it's like we don't want to walk down this road again. We don't want to spend a decades-long game of chase with an industry that will work for decades to deceive you about their product, deceive you about targeting kids, while they cash in, and you're just running, but they've paid better attorneys, better lawyers, better PR people, better lobbyists. That's what we're in store for. Here's our count in Colorado. We make 18 types of gummy bears, 7 types of cereal, 18 types of cookies, 6 types of soda, 14 types of juice, 12 types of granola bars, and 23 types of chocolate bars. This is not your Woodstock weed, as we say. This is a whole new game, a whole new game. The danger, too, of course, is how edibles are ingested. The high comes on later. So you hear, we'll talk about later, a lot of childhood poisonings and other poisonings go up because the way you ingest it, it's a slower high. So most persons will eat something and they'll go, nothing's happening, and we'll eat some more, and then it's really bad. So here is THC content again. This is THC content. This is seized marijuana. This is black market marijuana. Black market marijuana. 70s, 80s, 3, 4, 5%. This is not even coming close to explaining Colorado, but here's kind of later 2010, 11, where it's about 10%. That's the THC content. CBD content, you see that medical value. Shouldn't that be shooting up if we have all these great medical movements? That should be like shooting up because that's what it's all about, right? But it's really about this is what gets you high. So law enforcement will tell you in our state and our neighboring states, cartel marijuana is minor leagues to Colorado marijuana. We sell the most potent marijuana in the world, period. And that's when we talk about the data about mental health, about addiction. That's all studies that are done on a different time period with a different marijuana. What will the new marijuana show? Don't know yet. These are, by the way, the Peyton Manning strain is true, but it no longer exists. But this was an older ad. But you can see, look at the THC content: 24, 22, 18%. So you're talking 6, 7 times more stronger, more potent than it was if you were using marijuana in the 60s, 70s, or 80s, or 90s. It's 6, 7 times more powerful. We now mass produce hash oil. This can be 60 to 80% or greater THC, 20 times stronger than the marijuana you were using in the 70s or 80s or 90s. We mass produce it in beautiful package. And somebody said this looks like that Access spray, you know, the deodorant. Yep. Is that an accident? Who's that appeal to? And what was the packaging the cartel used for their marijuana? And did they mass produce it? So again, it's the fiction that we're now, are we safer with this? Are our kids safer? Communities safer? Here's marijuana dust. I didn't know what that was either. I'm like, what is marijuana dust? So same thing, highly potent. The high can last, may last 5 hours. So insanely potent marijuana. This is the world we have to be really scared of. Not that the past world I just told you wasn't scary. This is where it gets even scarier. The world of vaping. A youth and young adult know what vaping is. They absolutely know what that is. Some of us, when I talk to people who might be my age, like, what's vaping? What's a vapor pen? And so if you need to know about this if you're an employer, school, mom, dad. So we have two worlds. It's a perfect storm. We have two worlds colliding. We have a fast-growing nicotine vaping world. R.J. Reynolds, Philip Morris are now in the game. So they're going to create a lot. You'll see a lot of movement there, a lot more movement. And the marijuana vaping world is even more advanced than the nicotine vaping world. And we'll show you. So, and this is where the movement's going. I'm sorry to move in front of the screen. I know that messes up the projector a little bit. But this is the evolving world. So you have what are called tanks. This is a tank system that you put the liquid in. So this is, and of course these e-liquids all come in strawberry, bubblegum, cherry flavored, all kid flavored stuff. And so they go in the tanks and there's smoke, there's nicotine in there. From a tobacco standpoint, this is insanely dangerous. Liquid nicotine is very dangerous. The poisonings of children are going up across the country. It can get absorbed through the skin. A kid, you know, any small child sees strawberry and sees a little jar that big would want to gulp that down. Be almost deadly. It's insanely dangerous. So that, we'll talk about what the problem is. And this is the cartridge. And these are hookah pens. They don't contain hookah tobacco, but again, it's nicotine mixed with, and they're not regulated yet, so it's a crapshoot as to what's in them. But that should tell you, gives you a little idea. There's disposables, there's the tanks that you can change, and there's the rechargeables that come with these containers. And we have a big problem of growing vapor problem. The CDC just released this data that says 250,000 youth who'd never smoked used an e-cigarette in 2013. That's a 3-fold increase since 2011. So kids are catching on quickly to what vaping is. It's kind of like their modern smoking world, if you will. This is a marijuana vaporizer, or no, this is a nicotine vaporizer, that's a marijuana vaporizer. This is marijuana, that's nicotine. And the bottom line is you won't know. And it's the marijuana vaping industry is intentionally designing their products so you don't know. So I can use it in public settings in different places. So I encourage states, communities, make sure that vaporizing is in your smoke-free laws. Make it sure it's in your public, expand your smoke-free laws as we're doing in Colorado. Because again, you won't smell, we'll see their advertisements, that certain types of marijuana or hash oil I can use and you won't know. You won't know the odor, it won't be distinguishable. So I could be, you know, somebody could be serving somebody at a bar thinking they're just vaporizing nicotine. They may be vaporizing hash oil or something even more. So our Rocky Mountain Poison Control said, you know, that we've had people crushing up Oxycontin and putting in these. Former DEA chemist said most drugs are water soluble, so absolutely they could go in there. So that's the date. These are really, really good. These are glorified syringes. They're beautiful drug delivery devices, and they're very attractive. Yep, did you?
Just a quick question. In Colorado's efforts to legalize marijuana, did they develop a standard of identity?
A standard of identity?
Yes, sir.
What do you mean?
I work on the industrial side of the food industry, and everything that goes into that's consumed is, well, not everything, but a lot of things are defined. For instance, milk is total lactose secretion consisting of so much
okay.
water.
We'll get to the regulations that have come up around the marijuana products.
The whole time you're talking, I'm trying to say, what is marijuana? Not that I don't know, but to...
Yeah, we'll talk about that. Yep, we're going to talk about that. So here you can get marijuana vaporizers on Groupon. Yep. Again, beautifully designed. They're made for girls, boys, men, women. This is a whole new world. And again, this is vaporizing insanely potent marijuana. Kids that high school kids we talk to in Colorado, they go to the bathroom, they can get a hit of hash oil and go right back to class. And no one knows. Not like in my day when the plume of smoke came out of the bathroom, right? Remember that? Oh, some of you may remember. You know, like boom, yep, the door's open, like whew, you know, I wonder what was going on in there. But nowadays I can go into the bathroom, you get hash oil, and you're not going to know. I go back to class. So that's what's scary. These are all marijuana. You know, Snoop Dogg has his own line of vapor pens. We have a real big endorsement of vaporizing. And this is High Times magazine from last year said, it offers consumers a stealthy, convenient way to get high in almost any location. Rolling Stone called them the iPod of getting baked. It will produce a scentless vapor and get hit easily in a bathroom or on a street. So that's the danger. You can have public marijuana use happening in your parks, in your restaurants, anywhere you allow vaporizing, it can be happening. So that's very dangerous. And by the way, most of this should be medical, right? There's only 2 places that have commercial legal operations, but so these are supposed to be, I guess, medical devices. But again, is this helping us? Is this making kids safer? This, I would have told you from a trained eye, I would have told you that was e-juice. In fact, it's 100% top shelf THC, very potent, discreet like e-cigarette juice. So again, they're designing products to be hidden, to be concealed, to be used. Is that an industry that's interested in public safety and health? Is they're interested in following the law? In Colorado, there's a law against public use of marijuana. And in most states, there is. So, and this is look at the evolution of this. This Enjoy was a long time e-cigarette, but look what it looks like now. It's now a vapor pen. So this world is evolving and starting to look a lot alike. So this is the one I have with me today. This is, the marijuana user will know what these are on the front, but this is marijuana wax. And you have inside your little dabbing spoon. You can just put in your vaporizer, but also you can use it for e-juice. So this is the merging of the vaping worlds already in Colorado. So it can be made for marijuana, for nicotine juice. This is where we see Japan Tobacco is part owner of this vaping product, which vaporizes actually tobacco itself and marijuana itself. So again, all there. These are confiscated vaporizers from high school kids in Colorado, and you can see most of them are a tank system. Most of them are a tank system or e-juice system. And again, kids could put anything into these. There's sadly, I should have started this off. If you want to learn, I tell people I got my PhD in marijuana use from YouTube University. Because you go on YouTube and you can learn about how to bake marijuana, how to make marijuana. We also show you how to put synthetic marijuana spice. Is now in liquid form, which is very, very dangerous. You've heard about some of the deaths around spice. Those go into vapor. They'll show you how that goes into a vaporizer as well. So let's go finish up with our data. So we have more workers testing positive for marijuana. This was the most recent result. We had a 20% increase in marijuana positive tests, and the nation saw an increase of about 6%. And Quest Diagnostics said it's the first time in 10 years workplace drug tests have been on the increase nationwide. Childhood poisonings are up nationwide. States that started medical marijuana before 2005 saw their under 9 poisonings triple. And by this is a great study because it looked at medical marijuana states versus non-medical marijuana states, and non-medical marijuana states saw no increase in childhood poisonings. And those that had medical marijuana did. Our poisonings are up in Colorado. We have more auto fatalities. The number of auto fatalities in Colorado doubled from 2009 to 2011. And what the marijuana folks will say is auto fatalities in Colorado are down. And they are. But marijuana-involved auto fatalities are up. These are our DUID numbers. You can see the trend with marijuana positive for driving under the influence of drugs. Our 18 to 25-year-old marijuana use rate is 3rd in the nation. And so, again, that's a major problem. Again, with the brain, we are not preparing our 21st century workforce. The impact on the brain is very real. And as I tell people, the trend in tobacco is more and more companies saying, we don't want anybody using tobacco, period, because of the healthcare costs that come with it. And they're all not saying, hey, they're all testing for marijuana and other drugs as well. So when we green light young people to be using it, they're disqualifying themselves for tobacco or marijuana. We're limiting their workplace opportunities by doing that. Look at our ER visits, 8,000 in 2011, close to 13,000 in 2013. We saw a 50% increase in marijuana ER visits, and Denver is where most of the commercialization has happened. It's where the majority of our stores exist. So knowing that, and based on the marijuana lobby's statement that regulation makes us safer, makes our kids safer, makes our community safer, Denver should have the lowest rates of everything in the United States. Denver has more than 300 stores. So Denver, because they're the most regulated, we should have the lowest numbers. Denver's ER visit rate is 50% higher than the state average. This is the fiction of black market. Highway interdictions of marijuana to other states increased 397% between 2008 and 2013. Illegal activity didn't stop. Marijuana illegal activity is going up in our state. We're becoming a supplier to other states. And it's a constant refrain from police officers in communities that surround our state. You know, I wish one of them would give us the bill. Say, hey, Colorado, here's the bill for having to treat your problems. So we had 12 hash oil explosions in Colorado. Last year, we more than doubled that in the first 6 months of this year. We've had 60, this is from a report that came out, CNN covered it, 60% of our purchases are coming through legal channels, 40% are not. The black market still thrives in Colorado. If you want to look at anything to fiction and the deceit of the marijuana folks on the black market, look at Oregon. These are the same, remember, the same people that wrote our law are writing their law. This was decades in the making, and they say they're concerned about the black market. In Oregon's ballot measure that's on the ballot now, you can have 8 ounces of marijuana in your home, 8 times more than in Colorado. That equates to about at least 400 joints. You can have a pound of edibles. You can have 4 plants. A plant can produce at least a pound or more of marijuana, so roughly 3,000 joints. Where is that going to go? If I have 3,500 joints worth of at any one time, so that's at any one time. So that is feeding the black market. And this is the deception again. Oregon decriminalized in the 1970s. People are not going to jail when they're caught with a joint. They're getting a ticket. And the ticket doesn't give them a criminal record. It doesn't put them in cuffs, doesn't send them to jail. But yet the marijuana folks have this on their website with handcuffs. They're running an ad in Oregon now with a police officer and handcuffs that come up on the screen. So again, PolitiFact, which did the checking, said they were lying to the people. When in fact, almost all of these were citations. There were people that do get arrested. You get arrested if you're selling to minors, if you possess larger amounts, well, they're larger than an ounce. So let me go through this last piece. So child welfare, this young boy is dead. He died in a house fire when people were smoking marijuana on the other side of the house. He and his brother tested positive for THC multiple times and did so also on the morning of the fire. How it got in the system, don't know. But that's also a consideration when you do this, is child welfare and child safety. So remember, Denver should have the lowest rates in the nation, but their 8th grade use rate is almost 20%, almost 3 times the national average. Their 12th grade rate, all of these are higher, about 50% higher than the national average. Why didn't they make us safer? Why didn't that happen? Look at the red states are medical marijuana. This is 12 to 17-year-old, last 30-day use. Red states are medical marijuana. Blue are those that do not have it. See a trend? And Maine is, you are number, you're right here. We're number 3. Massachusetts, Rhode Island, and Vermont are number 1 and 2. Something's happening in the Northeast here. I don't know what it is, but remember, they talk about their caring for communities of color. This is the most recent high school data from CDC. Black and Latino youth are using at extremely high rates. Almost a third of Black and Latino youth are using marijuana. How come you haven't heard the Marijuana Policy Project screaming that, oh my gosh, we need to reconsider here, something's going wrong, right? But they're not. So this again, it's about addiction. So this is the new Mass General's study that 40% of users show sign of addiction. Again, higher than we experienced before. In Colorado, 1 out of every 5 of our adult users is using every day or more. So again, that's a lot. And they're consuming almost 70% of the marijuana. So it's about addiction. That's where I make my money. So we'll talk, Laura Harris worked for the Marijuana Enforcement Division. She retired to go work for a marijuana industry law firm who happens to have their offices on the same floor of the same building of the Marijuana Enforcement Division. So that's convenient. So let's not go back here. This is where we're going. We want to go in a different direction. To answer your question on where they are on regulations now, they're deciding what they're going to do is try to re-regulate. They are supposed to provide content and ingredients. That's still an evolving process. They're going to change. They want to make sure the edibles are put in smaller THC serving sizes. We don't know what that means. There's a hearing going on as we speak in Colorado today. But again, this is what, this is the reality of what these are actual. This is an actual, there's no marijuana in it. Law enforcement, I did not bring marijuana over the border. I promise you. People always call and say, can you send us marijuana so we can show people? I'm like, I can't send you marijuana. Are you crazy? I'm not going to send you, I'll send you packaging. But so like here's strawberry, these are strawberry hard candies that come in this beautiful package. And this is Tangerine Dream, and this is a little, hold on. This is 100 milligrams of THC, and this little thing you just drop into your drink, your Gatorade, get yourself really high. So that's what this is about. This is about legalization is not about social justice. It's not about incarceration. It's not about the black market. It's about mass merchandising. Medical marijuana, there is cannabis-based medicine. We hope that we continue to explore those fields and help those who can get help. But don't be fooled that there's the mass merchandising and commercial side of this. And there aren't, I don't know what's happening here, but I can tell you in Colorado, we don't have medical protocols. We're not helping those people who are going in. You can walk into a store. They're not being screened for health issues, not screened for mental health issues, not being asked if they're schizophrenic, not being asked if they have another substance abuse problem.
No prescription? No.
No.
It's not a prescription.
It's not a prescription.
It's a recommendation.
It's you get a red card. You don't get the doctor. You're not going in. You're not getting a prescription. The doctor's not reviewing your charts. The doctor's not saying, gee, we have a history of substance abuse. Maybe we want to reconsider this. Gee, your history of schizophrenia, maybe we want to reconsider this. A really sad story was I was in western Nebraska talking to them because obviously they're seeing people come from our state through their state. And this young woman came up and said she's working with at-risk kids. And she said, I have kids here, these are at-risk kids. She's got a young kid, vaping hash oil, family history of schizophrenia, and he is headed on the wrong track. And by the way, she says, you know what those at-risk kids want to do when they graduate? They want to come to Colorado and open up their marijuana business. And so that's the sad part of what's happening. So the truth is, this is not an experiment. We've done this before. The truth is, more people need to speak up. I hear, well, it's too political. Well, everything is political. Public health is political. Tobacco is political. Everything we do in tobacco is political. That's more, we need to get rid of that excuse because people need to hear what's going on and need to be given the facts about marijuana use. And what's happening out there. So this all impacts our safety, it impacts everything. So again, I'm chair of the Colorado SAM Coalition in Colorado. And Patrick Kennedy says it well, he's been open about, he's open about his issues of substance abuse and mental health. And he says, how can we as a country be working to improve our healthcare system, improve our mental health system, and commercialize a drug that negatively impacts both? Doesn't make any sense. Right? And so why are we going to head down? And as I tell people, I've worked for 20 years in tobacco. I've worked with low-income communities, communities of color, and I've yet to have one time somebody say, you know what? Alcohol and tobacco worked out so well, we could really use another drug here. Right? Could we get one more store, something else to sell here? It doesn't happen. So,
Bob, tell people what SAM is, because I'm not sure everybody knows.
So SAM is a kind of a national movement to really bring a public health and science-based approach to marijuana use. So it's using, we talked about the medical marijuana and cannabis-based medicine and moving forward with that in an FDA approval way, trying to make sure our justice system is treating drug use and trying to treat it and not just, we don't want to put young persons behind bars for having low-level marijuana use, and we're not. Our prisons aren't filled with low-level marijuana users. But again, much of our is really to educate people about the science and data on marijuana use and try to counter what is a really, as tobacco was, it's a very orchestrated campaign of deception to deceive people. So, and really, as Kevin Sabet, who runs SAM, has said, he goes, the greatest enemy of legalization is legalization. Because in Colorado, sadly, we're the guinea pig, and we're suffering from it. I wish I wasn't here telling you, I wish I was here as a tourist and just enjoying the beautiful state, and I wish we didn't have to go through this. But the hope is that people can see what we're going through. And our goal is to attract liberals and conservatives, Republicans and Democrats, because all of those issues that those individuals are concerned about are in this issue of marijuana use. So we're hoping that people, will join us. And again, Kim's also involved with Sam, who does research with the tobacco industry. So those of us who worked in tobacco, we've seen the movie before, and we don't want to repeat the movie. I'm not interested in that. So the harm, I can't tell you the stories of the mother who comes up to me and says, I had the good kid. I had the good student. I had the good athlete. And now they're using marijuana. I'm hoping they'll finish school, and I'm looking for treatment. I was at the gym, and this woman said, she goes, you got to talk to a friend of mine. Her son was top 10 in his class. Top 10, not 10%, top 10. And yet, regular marijuana use derailed him, same thing. She goes, do you know any place where he can go for treatment? Can we get him someplace? I mean, that's what's happening. There's there's a lot of moms that are involved with our group that will not tell you. They'll tell me the story, but they won't talk publicly because it's too painful. And that's understandable. But that's the reality of it. Not everyone is going to get addicted to marijuana. Not everyone gets addicted to alcohol. But underneath it, there are people that will. There's suffering that happens underneath all drug use. So I hope it was helpful today. So I'm happy to answer. I want to answer questions that you may have.